hospitalizations or downstream, major bad stuff like going to the intensive care unit or getting on a ventilator. And I would tell you that for our admissions, over 85% of those current state are in the unvaccinated population. That's dipped a little bit. It's typically has been around 90% for us. But for those that have the worsening type conditions, so they're in the ICU or on a ventilator, that number is even higher, mostly unvaccinated patients. So that is protective, and we really want to encourage you to do that. We have seen increased positivity in our pediatric population. That has not translated into many pediatric admissions. That's the really good news, but we have seen some of that nationally, so we'll keep our eye on that. There's three things that I'd ask you to do within the community. And to everybody's point, everybody's tired. You go around, there's a masking mandate out there. People aren't masking, right? They're getting tired of it, but it's really important that you continue to do that. Don't come to the ED for a test if it's just for a test. If you're sick or if you have other conditions, that's what the EDs are for. Please rethink your New Year's Eve plans. If you can, make it a smaller gathering, make it with your immediate family. If not, try to make it outside. Take advantage of this nice warm weather and be outside would be a really good way to think about celebrating New Year's. And the last one we already shared, which is the get vaccinated or get boosted. And with that, I'll turn it back to Dr. Washington, and happy to take any questions.
Thanks, Dr. Fletcher. And I'll just echo one more comment relative to testing. We are working with our testing providers to extend capacity as much as possible. But unfortunately, none of our organizations are, shielded from the impacts of COVID. And so we're having workforce challenges across the board at our community testing sites, our healthcare systems here at the health department. And so certainly we are, again, asking for folks' patience as we work to try to mobilize additional resources in the community. We are very hopeful that we will receive a new shipment of our rapid tests early next week, so we can relaunch the library distribution program, as well as looking at other opportunities to establish additional sites in the community over the course of the next week or so. So that's all coming. And again, please don't go to the emergency department. We need to reserve those resources for folks who really have urgent health issues in the community. Similarly, our medic team and our first responders are always busy this time of year and are experiencing strain as well as the workforce impact for that, our first responders. So please, again, let's, call 911 for emergencies only, because again, those resources are experiencing strain that happens this time of year anyway. And so we're encouraging our community to do that and help us all as we work to get through this surge. As Dr. Hunter said, we will definitely get through it if we all do this together. So with that, I'm going to pass it back to Gibbie to wrap us up and look forward to questions. Gibbie, you're on mute.
One last time I needed to mute myself. So, all right. So anyway, thank you all for the information. Just a few other quick things. We've had lots of questions about schools. Our schools will reopen again next week. There are no plans at this point to delay the start of school. I know that many parents have been concerned about that, but we do want to do everything we can to help our children stay in school and for us to have enough teachers and staffing support in our schools to be able to provide what our students need. So we did have conversation earlier today with our school system. They have been working on putting things in place to be as supportive as they can to students as they come back into school, and to parents who have questions. They'll be getting more information out over the weekend, and we are doing what we can to support them as well. The big challenge we have right now, I think, is the CDC guidance, which is a bit challenging to understand for people. And until about 30 minutes ago, what we understood was that the CDC guidance, the new guidance that allows people who have been fully vaccinated and are asymptomatic after 5 days to come out of isolation or quarantine if they don't have symptoms. This has changed again. Some of this will actually be the same for school students and teachers. So what we will let you know is that we will be putting guidance out on our website that's very specifically and clearly spells this out. We'll also be working with the school system to get specific guidance out to parents, teachers alike over the weekend. So we make sure that everybody has the most accurate and up-to-date information. But unfortunately, this is evolving as we're speaking, and people are trying to figure it out. So we will make sure that that guidance becomes available. The other thing that we reemphasized for our schools, our school system, and we need to emphasize it for parents as well as for just individuals in our community, is if you are ill and you have symptoms that you think may be related to COVID or that you've been exposed to somebody with COVID, please try to get tested. But we know that, as you've heard, testing is, our systems are strained right now. If you can't get tested, if you have symptoms, you need to stay home. You don't need to be going to school. You don't need to be going to work. You don't need to be going into the emergency department unless you have just a significant serious illness. You don't need to be calling 911. So please stay home if you have symptoms related to COVID. That's one of the major things that our parents can do and our teachers can do to support us keeping people in the school system as we move forward. The other thing that's been mentioned is we do have another holiday weekend coming up. This is a holiday weekend where people have a tendency to come together, and as midnight hits, they have a tendency to hug and kiss and do all of those sorts of things to ring in the new year. Well, this is not the year to do that. This is a year to have a bit more caution so that in future years, we're all still around to celebrate with each other. So please be very thoughtful about your New Year's celebrations and keep them a little bit more muted this year, and social distance, wear your masks, and above all, get vaccinated. The general direction that we're giving to our community, and it just gives me great pleasure one more time to give this message to the community. I know they're tired of hearing it from me, but they're going to hear it one more time. We have the tools to do what we need to do to protect our community, to protect ourselves, to protect those we love, and to keep things from getting worse here. Those things involve getting vaccinated if you are eligible. If you've been vaccinated and you're eligible for a booster, get the booster. You heard from the physicians here that it's safe, it's effective, you need to get vaccinated. That's the main message. But we also know that our masks, as much as people hate them, and I don't know anybody that likes wearing a mask. I have not had one person tell me, I just love doing this. Nobody likes wearing a mask, but we do know that that's effective in helping prevent the spread of this virus. So wear your masks, especially in public and especially in locations where there are a number of people around you that you're normally not with. Socially distance as you can and avoid those large crowds. It's critically important. And as was mentioned earlier, if you can be outside, do that. But these are the things that we know are going to protect our community and help us keep this virus from ravaging our community and overloading our healthcare systems and our other systems in this community over the next month or so as we get through the winter. So please, please do your part. That's what we need you to do, is do your part. That can be your New Year's resolution, that I'm going to do my part to do what I can to keep this virus under control and to get our community back to a more normal state. So with that, I will stop and we will open for questions and answers. Thank you.
Thank you, Gibbie. And just as a reminder, please, when you ask your questions, please state who the question is for. First question today goes to Doss Helms, WFAE.
This may be pretty quick because Gibbie kind of anticipated my question about schools. We know that masks are required in Charlotte Mecklenburg schools, but often optional in some of the charter and private and nearby districts. Any advice for families or for officials in those types of schools? And I guess that would be for Gibbie or Dr. Washington.
Yeah, thank you for that question. Yes, they are mandated in our public schools, but because we have a mask mandate in this community and we've been clear in that mandate that private and parochial schools are included in that mandate, all of our schools in Mecklenburg County should be requiring masking unless there is some medical reason for that child or that teacher not to be masked. Yeah, unfortunately, many of our surrounding counties are not doing the same, but we need to do our part here in Mecklenburg County. So yes, our schools, all of our schools should be masking as we move back into the second half of the school year.
Next question is Katie Soloff, Axios. Katie Soloff, you're up.
Sorry about that. I was muted. This is Katie with Axios. I had a question for Dr. Washington about rapid tests and the shipment next week. How many tests do you anticipate will be part of that shipment? And how many libraries do you guys anticipate you'll be able to distribute to and when?
Yeah, Katie, thanks for that question. Unfortunately, we are unsure. We're facing a number of supply chain issues and shipping issues at this time, and so our orders are being split up. Even those that were supposed to be already are being split up in smaller pieces, and so I'm hesitant to say how many and at what level we'll be able to reoperationalize the program, as well as when. I am very hopeful it'll be next week, but again, until the shipment's here, we will not be able to commit to that. So we will notify folks as soon as we are able to relaunch the program. But again, it should be sometime next week.
Next question, Chloe Leshner, WCNC.
Hi, everyone. Thanks so much for doing this. My question is also about those rapid tests. What should people do if they test positive with a rapid at-home test? How should they be reporting it to you? I know many people probably don't. So do you guys have any plans to maybe create some portal where they can, so that the data that's out there in the county is the full picture?
Sure. Thanks, Chloe, for that question. So we are following state guidance relative to rapid tests reporting. So at this time, and which is driven by sort of the CDC's case definition for positive cases, which does not capture those tests in the reporting for a number of very important reasons. And so at this time, if an individual tests positive with a rapid test, the first thing they should do, of course, is contact their healthcare provider. Especially if they're having symptoms and don't feel well, they should let their primary care provider know, and so that they are aware. And if they need to provide any guidance to that individual based on their healthcare situation about what to do next. But otherwise, in general, those individuals should adhere to the isolation instructions as Gibbie described earlier. If you are symptomatic, you should isolate for at least 5 days. If you're asymptomatic, again, at least 5 days until your symptoms have resolved. And so those individuals who test positive, they should stay away from others. And of course, if they still have symptoms, continue to stay away from others, even if it's been 5 days. And from there, that's all those individuals would need to do. It is not necessary to go receive a PCR confirmatory test unless, of course, your healthcare provider has advised you to. If you don't have a healthcare provider, certainly there are some resources on our the mecnc.gov/COVID-19 that might be able to assist with that. But in general, isolation or self-isolation is the first task and most important part of that, and making sure that you obviously, if you have severe symptoms, to deal with, to get in contact with your healthcare provider.
Next question is from Drew Belia at WCCB, and Drew's microphone is malfunctioning, so I'm going to ask the question for him. This is for Dr. Hunter or Dr. Fletcher. Based on the data you're seeing, is Omicron a more dangerous strain compared to previous strains for people who have previously been infected and are fully vaccinated?
I'll go ahead and start with that. This is Dr. Hunter with Atrium. Dangerous is really that word is a little difficult. We know that it's more contagious. There is some evidence now that is less severe. Certainly, the vaccinations markedly decrease the effect of the virus on your body. And so depending upon your condition, your vaccination status, your comorbid conditions, all of these are extremely serious, which is why all the precautions and the vaccinations need to be taken. The vaccinations do mitigate the impact of this virus to a very large extent. So again, as everyone has said, we encourage that and its booster.
And the follow-up to that question is
Can I just throw something out there as well?
go right ahead.
So this is Sid Fletcher with Novant Health. The other thing I would just mention is I completely agree with Dr. Hunter in that it seems to be less serious in general, but that doesn't mean any one individual might not have a significant problem, end up hospitalized in the ICU, or have a death as a result, especially for those with comorbidities and especially in the unvaccinated. The other thing is, because of the infectivity, you just have to really consider that logarithmic jump in the number of people who are positive. So even if people generally do better, when you're talking about large populations of patients, that could mean that there's a lot more patients that need hospitalization, even though it's relatively lower with Omicron versus, say, Delta. We don't know that for a fact, but that's what I would tell you is that the concern would be we still could have a huge number of people that need hospitalization because the numbers of positivity in the community become so large. Thanks.
And a follow-up question to that question from Drew. At what point or based on what metrics will any sort of mandates, shutdown, restrictions be enacted or recommended?
Yeah, so there really isn't there's no inflection point, so to speak. We continue to monitor the situation in the community relative to what's happening. But I think it's been said on this call, COVID is here. It's a part of life now, and we have to work to live with it. And we have all the tools necessary in our community to be able to help keep us safe and to protect us and to lessen the impact of its spread on the community. And so we've got to focus in on doing those things, and that's vaccination, boosting, wearing masks, avoiding large gatherings, and really going toward, what's safer for me as a person, right? Is it safe for me to be in a room with 200 people without mask on and think probably not the best idea? Someone probably has COVID. So we need everybody sort of to be a part of that solution, because again, no one wants to shut down, and COVID's not going anywhere. It's going to be here. It's going to surge in our community, cyclically, and we have to use the tools we have to be able to protect against it.
Next question is from La Noticia.
Hi, this is Jasmine Herrera with La Noticia. Thank you for taking my question. I did want to ask either Dr. Fletcher or Dr. Hunter about just the efficacy of these rapid tests. A lot of people are relying on these at-home tests to decide whether or not they are going to these gatherings. Just wanted to know if you could give us, in comparison, whether to PCR, or you could give us some sort of percentage as to how much we should be relying on the results of these exams.
Hey, this is Sid Fletcher. I'll take that one. What I would say is that the efficacy of each kind of test is very specific to that test. So most of the ones that you're going to get over the counter are going to be non-type PCR tests. Many of them detect antigen, things like that. And just know that they are not necessarily the best, and they tend to have some more false negatives. That's the thing that I would be particularly concerned about, because what you really want to know is if you have it or not. And so what can happen is it could say it's negative and it may be wrong. Most of them are about 85%, 85 when you're looking at a non-PCR kind of test. I would say if it says that you're positive, they're actually pretty accurate. So if it's saying that you're positive, you probably can rely, especially because hopefully, the reason you're not just taking a test for no reason. So we always talk about pre-test probability, the likelihood that you might have it before you even take the test. So if you have symptoms and you see that come up positive, that's likely a very reliable test.
Thanks, Dr. Fletcher. And I'll just add one caveat, one note relative to folks using the rapid test in the community. If you start experiencing symptoms, sometimes it takes a day for those tests to be able to be more specific in detecting an infection. So if you have symptoms on Monday, it's always a good idea that you can self-isolate for 24 hours and then take the test. It will give you a better probability of being able to be more accurate in its detection.
And this is a little bit more specific too. Let's say you were exposed, but you're asymptomatic and you test negative. How long should you wait after that initial negative to test again, just in case it is a false?
So recommendations is if you were exposed, let's say again on Monday, the recommendation would actually be to wait several days, as many as 5 days before you actually test for the first time. So if you went to a gathering on Sunday and got exposed, it's not very helpful to get tested on Monday. You want to wait at least 4 to 5 days before you go get tested to give your body a chance to, if you are going to develop an infection, for it to develop and be detectable. So my advice would be, if you not to get tested on that first day. If you are fully vaccinated, you don't have to quarantine at home. You can certainly wear a mask if you go out in public. If you're not fully vaccinated, you should still quarantine for those 5 days and then get tested on that day 5.
Thank you.
Next question is Emma Withrow, Fox 46.
Hi there. So 2 questions here. The first one's just a quick question. So if you test negative or positive on a rapid test, and then you get your PCR test back a few days later, and it comes up the opposite, which one is accurate, and how should people differentiate between which one would be more accurate in terms of the positivity or negativity of your test? And then the other question is, with the reduced isolation or quarantine time from the CDC for guidance for people who are fully vaccinated, how are schools going to adapt to that, or is anything going to change in terms of outbreaks in schools throughout Mecklenburg County with this new CDC guidance for quarantining and isolation for students or teachers that are fully vaccinated who are, testing positive?
Sure. As Gibbie alluded to earlier, we had anticipated that CDC guidance actually would not apply in the K through 12 setting, but have recently received guidance that, in fact, we will be adhering to that in the state for K through 12 settings. So we're working to operationalize that guidance now and make sure that our education partners are all aware and are able to implement that in the school setting as well. Your first question was about the discordant results. The PCR is certainly more superior of the tests than pretty much all of the rapid antigen tests. It tests for something different. I won't go into the science of it, but it is a more superior test. So, of course, the individual should consult with their healthcare provider that are conducting or ordering the test. But in general, the PCR test would be the more of a superior or the more definitive answer relative to an infection.
Next question, Brett Jensen, WBT Radio.
Yeah, this is for Dr. Hunter and Dr. Fletcher. It was about this time last year, just middle part of January, when you guys were seeing your biggest influx of COVID patients, especially in the ICU. And I remember last year, Atrium was somewhere around 55, 60% ICU capacity, being nothing but of COVID patients. Where are you guys right now in terms of percentages for your COVID patients in ICU? And the other quick follow-up is, Novant, you guys have been extremely open about this from day one, saying that staffing was always the biggest issue. It was really never the bed capacity. And both you guys were both saying it was never bed capacity, but it was just more about staffing. So is staffing still the biggest issues that you guys are facing right now?
Yeah, this is Sid. So I'll start. What I would tell you is that it's really both. So when you talk about beds and staffing, we do have challenges around staffing, and I would also say that over the holidays, there's always a little bit of challenge related to additional workers and travelers that continue to help us try to navigate our staffing situation, make sure that we have enough staff available. But it also is real physical beds, so it's really both because the volumes have been so high. We expect higher volumes in the winter anyway. That's typical in the winter season. It's just that now we're experiencing more of that. In terms of capacity within the hospital directly related to COVID, I would say we're current state way under where we were last January when we peaked. That doesn't mean that we're not having some challenges, but I would say we're also not seeing a lot of, at this point, downstream ICU patients, although we know there's a lag that goes into that. So that means, first the patients come in, then they deteriorate if they're going to, or they improve and go home. But if they do deteriorate, that takes a period of days and or weeks, before they end up being located in our intensive care units. And we're not seeing much pressure there now, but we expect downstream pressure as we have more patients that are admitted into the acute care facilities.
Thanks, Sid. And so this is Dr. Hunter with Atrium. So our ICU numbers are less in general than they were a year ago. Our actual numbers, of course, fluctuate day to day, and through the week. But it does seem like the ICU intensity is a little bit less. Of course, we now have, known federally approved effective vaccinations. We have multiple known treatments as well. We have all the extra knowledge that we talked about, for this virus as well. And so certainly that plays a part. And now we will wait and see how it goes. But compared to a year ago, the ICU is not as critical a factor as it has been. As far as staffing goes, staffing is an issue. Staffing is an issue everywhere in healthcare. Our teammates have done absolutely incredible things really over the past 2 years. And so there are also many lessons learned of how to be efficient, how to be effective, how to maintain quality during these waves that we've had. And so again, we are better prepared for this wave than we were for any of the others.
Next question is Chloe Leshner, WCNC.
Hi, this is probably for Gibbie or Dr. Washington. Are there any plans with trying to expand some of this testing to bring back any mass sites?
Hey, Chloe, thanks for the question. We are looking at, a lot of our sites are kind of mass sites right now by virtue of the demand, but we are looking to look to see if there are opportunities to bring on additional testing providers to provide additional sites. I'll just make a point. We have a lot of testing sites in Mecklenburg County between our healthcare systems, our StarMed partners, our other community testing providers. There are a long list of folks who are doing testing in the community. Our testing site locator is a great tool. Folks are using it. You can call the hotline. They can help you identify places that maybe not so congested, but we encourage folks to look at those sites to see what other options exist outside of the ones that most people commonly use. And so we definitely have a lot of demand. Part of our strain is because we have a lot of folks coming from other counties to also receive testing here because we have so many sites. And so we're working to make sure that we can, as we can increase capacity, we will. But as you just heard, staffing remains a challenge for our entire healthcare system. It remains a challenge for our testing providers in the community. Their staff are on the front lines. They are exposed to COVID at home and other places as well. And so staffing remains a huge challenge across the board. And so that is one of the biggest challenges we have to be able to just set up new sites. And so we're working as best we can to do that and identifying partners that can help us in that work to make sure we can make testing as widely available as possible.
Next question is Hannah Smoot, Charlotte Observer.
Hey there, this may be for Dr. Washington, but Dr. Hunter and Dr. Fletcher or Gibbie, if you have anything to add, please jump in. I'm wondering with the at-home tests, with those positives not being counted in the state data releases, are you focusing on hospitalizations as, a bigger indicator of what COVID spread is looking like in the county?
I don't know, not necessarily. So in terms of community spread and how much transmission is happening, we focus on our total case counts, the number of people who are coming in to be tested every day, so testing demand, and of course the percent positivity. It is certainly a very helpful indicator for us, just because we have more rapid tests being used in the community over the counter, which in fact right now, we don't really have a large supply of them in the community, so there's not much of that happening. But so most of the testing is happening at testing providers. And so we're still confident and relying on the percent positivity as one of our metrics that we track over time. And it remains a helpful tool to understanding how much spread is actually happening in the community.
Next question, Anthony Kustura, WSOC-TV.
Thank you so much for the opportunity. This is a question for Dr. Washington, sort of piggybacking off of Chloe's question just a moment ago about expanded testing. When you talk about, working with other providers, can you elaborate on who that might be with? Would that be at the federal level, National Guard? Who are those conversations happening with right now?
Sure. Just to re-emphasize, the National Guard are still present here. They're helping out. If you've been to one of StarMed sites, you see them here as well. We are talking with the state about other vendors that may have capacity to deploy in other communities. But again, the strain that we're feeling in Mecklenburg is being felt across all of the state of North Carolina and across this entire country. And so we continue to look at all available options, all available testing providers. We have an enormous number of providers working in Mecklenburg every day at smaller sites across the county. Our pharmacies are still helping and doing their part. And so we have a huge availability of testing. It's just this is unprecedented demand. And so we're going to do what we can to try to alleviate some of that demand and provide some more supply. But the reality is that there's a very tight resources at this time to do that.
I do have a follow-up question for Mr. Fletcher and for Mr. Hunter. When we talk about some of these more popular testing sites, 2, 3, 4, 5 hours some days, is the hospital system seeing that these long wait times as well, or is that kind of where the recommendation is coming in now to maybe look at some of these alternatives to see if the lines aren't as long there?
Well, so this is Dr. Hunter. At Atrium Health, every single day we are assessing how we can expand our testing. And we've already expanded sites, expanded appointments. Starting on January 3rd, we're going to expand for more sites. And we do that while keeping our primary focus on caring for the patients that are in our emergency departments and in our hospitals, in our hospitals as well. And so that's where our primary focus is. So we have been expanding these and go by appointment for the sites that we have. And we also recognize that the community has a great desire for this test, which is appropriate, and we are part of that picture.
Yeah, this is Sid Fletcher. I would tell you that, we're mostly focused on the symptomatic people, meaning, people that they're going to have a runny nose, going to have a cough, things like that. But for the asymptomatics, we would encourage those people to try to figure out how they can make appointments at local retail pharmacies and others that offer opportunities to be able to get that. If you're trying to return to work, if you're trying to travel, things like that, we are trying to expand our testing as well. It's very challenging, and again, it's somewhat related to trying to spin up higher numbers when we're trying to support all the other things that are going on the acute side of the hospital as well. So I think anything that we can do to try to use all of the resources that are available, but use the ones that are appropriate to the clinical condition for the patient is probably the most important thing. So if you are ill, then the ED may be the right venue. If you're not, then the ED certainly is not.
And I'll just also add relative to testing, if you are sick and you have symptoms and they're mild and manageable, and you don't want to wait in a 4 or 5 hour line to get tested, you can always stay home and assume you have COVID and isolate. And there's certainly nothing wrong with that, as long as you're not spreading the virus to others in the community and you stay isolated until you feel better, or hit that 5-day mark. You certainly are able to do that without having to go to sit through the 4 or 5 hour wait to get a COVID test.
Next question, Emma Withrow, Fox 46.
We've seen some of the private colleges require the booster shot, but there's also been talk about remote learning starting off next semester. So what are you guys recommending to places like Queen's University, Davidson College, and even UNC Charlotte?
Certainly. So our teams are checking in with all of the local institutions of higher learning here and are working closely with them to make sure that they have all the tools that we can help support. We certainly, again, are encouraging them to use the tools that we have. So whether that be requiring vaccinations and boosters, offering vaccinations and boosters, offering re-entry testing or requiring re-entry testing, and certainly having resources available on campus to protect students from transmission while they're either in dorms or in classrooms is high priority. I think it's already been said on this call, COVID is not new now. It's been here for almost 2 years, and we have learned so much about it, and we have so many tools at our disposal to help us mitigate the spread or impact of it. And I think our university partners are well prepared and well equipped to use those tools and are doing so as much as they possibly can.
I have another follow-up question from Drew Belia at WCCB. For the doctors, is there anything to be gleaned from a later variant being more contagious but having less serious symptoms?
You know, there's lots of speculation on this. This is Dr. Hunter again. You know, it means that we were not fully vaccinated and the world was not fully vaccinated. Every time that this virus spreads from one person to another, it has a chance to mutate, and given enough chances, these variations will come in. But I don't think you can take it further than that.
Yeah, I would also say that, you know, when things are more virulent, meaning that they kill people rapidly, they tend to not be as contagious, right? Because they die out. And that's sort of a standard microbiology thing. So it's not entirely surprising that that people that, you know, have been maybe not quite as sick, but this has taken off like crazy, and that it's become quite contagious within the communities that Omicron's been found in.
Floor is open for follow-up questions. Any further questions today? Okay, at this time, I'd like to turn the microphone back over to Health Director Gibbie Harris. Gibbie.
Thanks, Bill. I asked Bill for a few minutes at the end. As has been mentioned earlier today, this is my last media availability, as well as my last day of work in Mecklenburg County. And I just wanted to take the opportunity to recognize all of the work that's happened in this community. Dr. Hunter and Dr. Fletcher personally have been on the front lines of this from the beginning, but both of their healthcare systems have been incredible partners with public health in addressing this issue. The leadership in this county, our staff, all of the work they have done. And so I just wanted to thank everyone for their engagement and involvement in this. I want to thank the community for all of the things that they have done to help us get to where we are. It's been mentioned several times today that we have the tools now in place. We are in a better place than we were last year. And it may not seem that way right now because of the number of cases we're seeing, but we are in a better place. We have tools, we have treatments, vaccines, we know to wear masks, all of those sorts of things. So again, thank you to the community for the opportunity to have served you for the last 4.5 years, and to all of our partners that have supported the public health effort, which is more than just the health department, as we've tried to address this pandemic effectively in our community. So with that, Bill, I'll turn it over to you.
Thank you, Gibbie. And thank you, everyone, for attending today and helping us get the word out. Have a happy new year and be safe.